While continuing with respiratory diseases, we'll discuss diphtheria and pertussis. Both are bacterial diseases of respiratory system, both spread by droplet infection. We'll discuss this session according to following learning objective. We'll discuss diphtheria, we'll discuss its epidemiology, clinical features and management. Then we'll discuss epidemiology, clinical features and management of pertussis, which is also called whooping cough. And then we'll summarize the session. Let's start with diphtheria. Diphtheria is a bacterial disease of respiratory system and it spreads by toxins. The main feature of diphtheria is toxins. Corynebacterium diphtheriae produces toxins which produce the disease. And the other significant feature to remember is that diphtheria spreads mainly or predominantly through carriers. These are two main features. It's a bacterial disease that spreads through toxins and it spreads through carriers. Carriers are those who have mild symptoms or are those who are asymptomatic but they spread the disease. As you can see that diphtheria is caused by Corynebacterium diphtheriae toxin, and then it causes headache, weakness, fever, swelling of glands, swelling of neck. It produces cough cause it spreads to pharynx, larynx, and then difficulty in breathing is common in diphtheria. These are few complications. Airway obstruction. It can cause heart failure if remain untreated. It can cause nerve damage, paralysis, pneumonia. It can also cause death. So we need to treat diphtheria. We need to prevent diphtheria. Diphtheria is preventable and treatable disease. Because it's bacterial, we can give antibiotic. We can give antitoxins. This is the treatment. We have to spread the limit to fomites because it spreads to fomites. So these are few pictures to remember, and this is prevention of diphtheria. We can prevent it through vaccination. We can do specific measures. We can do general measures. So you have to remember cause, its symptoms, its diagnosis, and its prevention, plus its complications. This epidemiology of diphtheria. We start from time when it is more common. Like all the diseases of respiratory system, diphtheria is more common in winter season. Place. It is common in overcrowded places. Overcrowding is the main feature. Person who is getting the disease, those who are vulnerable, those who are susceptible, like children. And doctors and nurses working in PEDS ward. So doctors and nurses are also vulnerable. So we need to vaccinate them. Incubation period. Incubation period of diphtheria is very short. It is from 3 to 5 days. It remains communicable 3 to 5 days. Mode of transmission, like all other diseases of respiratory system, it spreads through droplet infection. Droplets spread diphtheria. Contaminated articles also spread diphtheria, like utensils, clothes. So it spreads through fomites. But the major mode of transmission is droplet infection. When a person coughs or sneezes, he can spread it through fomites or utensils or through clothes. So, what will be the epidemiological triad of diphtheria? As it is a bacterial disease, so it is caused by Corynebacterium diphtheriae. Our causative agent is Corynebacterium diphtheria. Host, children. Predominantly, it spreads in children. Environment, overcrowding. Plus, it spreads through carriers. You must remember this. It is a common university question that diphtheria spreads through carriers. What are the clinical features? Major clinical features can be fever, mild to moderate. It can cause cough. It can also cause sore throat. It can also cause hoarseness of voice, cause it can spread through larynx. So can remember the major clinical features like fever, mild to moderate, cough, can be productive, sore throat, hoarseness of voice. There can be nasal diphtheria. These are various types of diphtheria, nasal diphtheria. It can affect nose. It can cause sneezing. There can be pharyngeal diphtheria when it affects pharynx. Pseudomembrane is formed on pharynx. So there is cough and laryngeal diphtheria when it affects larynx. Pseudomembrane spreads to larynx. It causes hoarseness of voice. Diphtheria can also affect skin. It can also affect forearms. There can be cutaneous diphtheria. It affects forearm skin and form a non-healing ulcer. So you can remember from non-healing ulcer. These are the major symptoms. It starts from sore throat, swelling of neck. It can also affect lymph nodes and low-grade fever. And you can see pseudomembrane. This is pseudomembrane, grayish-white pseudomembrane formed on tonsils or on pharynx. This is diagnostic sign of diphtheria. Our major diagnostic sign of diphtheria is pseudomembrane. You can pick it from the scenario. They can ask that a person or a child of 10 years of age having pseudomembrane or pharynx. He has mild to moderate fever and sore throat and swelling of neck. What is your diagnosis? Your diagnosis should be diphtheria. Because pseudomembrane is symptom or pseudomembrane is diagnostic sign of diphtheria. Then it can cause difficulty of breathing. It can cause hoarseness. So how will you manage diphtheria? First, you have to diagnose diphtheria. There are two types of tests, diagnostic test and screening test. So you have to remember Schick test and culture. What Schick test indicates and what culture indicates. Schick test, if Schick test is positive, person is susceptible to diphtheria. He's not having diphtheria. It's a screening test. Diagnostic test is culture. So you have to remember, you can pick the scenario if they ask a person having Schick test positive, but culture is negative. What is your diagnosis? If Schick test is positive and culture is negative, you can say he or she is susceptible to diphtheria. But if culture is positive, it is confirmatory test. You can say that person is having diphtheria. Why we need to distinguish? Because the management is different. If person is susceptible and if person is diseased. If person is susceptible, we can give vaccine. If person is diseased, we can treat the patient. So you must remember this. This is a common university question. What to remember? You can remember that if Schick test is positive and culture is negative, person is susceptible to diphtheria. And if Schick test is positive, culture is positive, person is having diphtheria. These are the two tests of diagnosis of diphtheria. How will you manage the case of diphtheria? How will you manage a susceptible case? So first we'll start from susceptible case. Nurses, doctors working in PEDS ward or staff working in PEDS ward can be susceptible to diphtheria. So how can we manage a susceptible case? Simply, we can give vaccine. Diphtheria vaccine is available in the form of DPT. Or we can give single vaccine of 0.5 ml intramuscularly. To those who are susceptible to diphtheria, they must be vaccinated. And we can give prophylactic antibiotics also. Prophylactic antibiotics. Penicillin or erythromycin can be given. Why we need to treat susceptible cases, or why we need to manage susceptible cases? Because they can develop diphtheria. They are susceptible. They are at high risk. We have to protect them. We have to prevent them. We have to protect those working in PEDS ward. We have to protect those who are susceptible or living with the children having diphtheria, because it can cause mortality in children. Person who are susceptible can affect children, can affect healthy ones. How to treat cases of diphtheria or carriers? As we know that diphtheria spreads from both cases and carriers. So we need to manage both cases and carriers. Because carriers can spread disease without having infection. They spread the disease, they transfer the disease, they increase the burden of disease. So what can we do? First, we should give antitoxins. Diphtheria antitoxins, because it spreads through toxoids. We need to give antitoxins to children. We can give antitoxins to older ones. Dose is very different. Second, we can give antibiotics like erythromycin and penicillin. Then we can give antipyretics, reduce fever. We can also give antitussives to reduce cough. Plus, we can also improve hygiene. We need to improve the hygiene and disinfection. But before giving all this treatment, we need to isolate the diphtheria patient, or we need to isolate the carriers. First we'll isolate, then we'll treat. Isolation and notification. Why notification? Because it can cause epidemic. It spreads rapidly. It spreads from person to person. So we need to notify to higher authorities that we need to control diphtheria, we need to vaccinate, we need to treat. Then we will give antitoxins, antibiotics, antipyretics, antitussives. We can improve the hygiene. We can do disinfection. Then after treatment, we need to vaccinate. So we'll give vaccination after treatment or after completion of treatment. Diphtheria vaccine is added in EPI schedule. This is a common university question, that when diphtheria vaccine is given to children. Remember this, it is given on 6 weeks, 10 weeks and 14 weeks in the form of pentavalent. What pentavalent contains? DPT component plus Haemophilus influenza plus hepatitis B. So it is given on 6 weeks, 10 weeks and 14 weeks. And booster dose is given at the age of 2 years and 5 years. Booster dose of diphtheria is given. This is routine immunization of every child, but it can be given at any age. Anyone who is susceptible, who had diphtheria in the past, can be given diphtheria vaccine, either single or either in the form of pentavalent or DPT. So, to control diphtheria, to prevent diphtheria, to manage diphtheria, we need vaccination as well as treatment. Cause treatment is available. We need to control this cause it spreads through toxin and can cause complications. It can cause cardiac complications. It can cause pneumonia, it can cause encephalitis. And you have to remember that pseudomembrane is diagnostic sign. You have to remember Schick test and culture. Now we'll discuss pertussis. Pertussis is also a bacterial disease. It's a bacterial disease. It is common in children less than 1 year. Or we can say that it is more severe in children. It is also called whooping cough. So other name of pertussis is whooping cough. Why whooping cough? It produces whoop. So, pertussis, it's also spread from droplet infection. As you can see a child having cough, it is also called 100-day cough. Non-productive cough. What is epidemiology? You must remember time, place, and person. When it is happening or when it is predominant. It is predominant in winters. Where, like all other respiratory diseases, it is common in overcrowded places. The place, overcrowding. Urban slums, barracks. Person, children, especially in less than 1 year. Incubation period is from 7 to 10 days. It's 7 to 10 days. Mode of transmission, like all other diseases of respiratory system, droplet infection. What is triangle? As we have discussed that diphtheria is a bacterial disease. It is caused by Bordetella pertussis. It's a causative agent. Bordetella pertussis is causative agent of diphtheria or by Bordetella parapertussis. Host, children, environment, overcrowding. So it is common in low socioeconomic status, common in children of low socioeconomic status, common in malnourished children, common in children less than 1 year. It is more severe in children of less than 1 year. What are major clinical features? As the name indicates, cough. So, cough is main symptom. Which type of cough? Non-productive cough. Non-productive cough. Then fever. Cough and fever are predominant symptoms of diphtheria. Non-productive cough, mild to moderate fever. Plus, during cough, there may be vomiting and cyanosis. A mother comes to you and tells you that her children is having cough from the last 20 days, 30 days. Child becomes cyanosed during cough episodes. Cough is non-productive. He has vomiting. So you must think regarding diphtheria, as regarding pertussis. These are the common symptoms. You can remember fever, cough, sore throat may be present, plus cyanosis and vomiting. So what is the management of pertussis? How we can manage this? First, we'll start from treatment. It is a clinical diagnosis. So you can start treatment. You can give oxygen. Why oxygen? Cause of cyanosis. So O2 inhalation. We can give antipyretics. We can give antibiotics. We can give antitussives. We can give antiemetics. Plus, we need to maintain hydration caused from cough and vomiting. There may be dehydration. So we need to maintain hydration status of children. IV fluids can be given or ORS can be given. Otherwise, child may suffer from dehydration, severe dehydration and can die. We need to manage diet as well. This is the management or treatment. What will be the prevention? We need to prevent it. How we can prevent it? Like all other respiratory system, isolation. We need to isolate the child. Notification. We need to notify. Disinfection. Awareness, hygiene. We need to improve the hygiene. These are the general measures and they can be done through health education. We need to educate the parents, we need to educate the families, we need to educate the community. And then we can do specific protection. So its vaccine can be given at any age. Remember this. Plus, it is included in EPA schedule. What is the schedule? 6 weeks, 10 weeks, 14 weeks. With diphtheria vaccine, it is given. And at the age of 2 years and 5 years, booster dose is given. Plus, remember that diphtheria causes cough. It can spread from older ones to children. So we need to vaccinate older ones also. We can do vaccination in old age people like 70 years old, 60 years old to prevent the spread, to prevent diphtheria, pertussis, to prevent the complications of pertussis. So we need to control them. We need to vaccinate. So you must remember that its vaccination is same as diphtheria. Both vaccines are given at the age of 6 weeks, 10 weeks, 14 weeks, plus booster dose is given at the age of 2 years and 5 years. It can cause severe complications. So you must remember the complications of diphtheria, pertussis. What will be the complications? Remember from cough that it can cause refracture. It can cause refracture, it can cause hernia. It can also cause rectal prolapse. It can also cause pneumothorax. These are specific complications of pertussis. Refracture while coughing. Cough can cause fracture of ribs in children. It can cause hernia. It can cause rectal prolapse and pneumothorax. Other complications are same as other diseases of respiratory system like pneumonia and encephalitis. So this is whooping cough. This is doctor call the disease pertussis. Whooping cough cause it produce respiratory whoop. Bacteria enters the respiratory system. It enters through droplets infection. And you can see that it spreads to children and can cause severe cough. It can affect the lungs. Things to remember in pertussis, complications and its symptoms. Cough is major sign or symptom of whooping cough. It produces a whoop. It is also called 100-day cough. Now we will summarize. We have discussed diphtheria and pertussis. Both diphtheria and pertussis. Both are bacterial diseases. Both affect respiratory system. Both can cause severe complications in children. Diphtheria, you remember that diphtheria spreads from toxins. Corynebacterium diphtheria provides toxins. They invade the cells and tissues and cause the disease. Diphtheria predominantly spreads from carriers. Diphtheria has hosts, both those who are susceptible ones. Doctors, nurses, children are hosts of diphtheria. What are the major symptoms of diphtheria? You must remember pseudomembrane. Pseudomembrane is present on tonsils. It is diagnostic sign of diphtheria. Diphtheria can affect nose, pharynx, larynx, and skin. There can be nasal diphtheria, pharyngeal diphtheria, laryngeal diphtheria, cutaneous diphtheria. If it affects pharynx, it can cause cough. If it affects larynx, it can cause hoarseness of voice. There is mild to moderate fever in diphtheria. Ultimate sign is pseudomembrane. And then we will diagnose it. There is Schick test and culture test. If Schick test is positive, person is susceptible to diphtheria, is not having diphtheria. Culture is diagnostic or confirmatory test of diphtheria. So you can pick the scenario from Schick test and culture. Remember this. Then how to manage diphtheria? Bacterial disease, we can give antibiotics. We can give antitoxins. Penicillin and erythromycin can be given. We can give antipyretics. We can give antitussives. Then we need to prevent others. We need to prevent children. We need to prevent those who are susceptible. So we can give vaccination. Remember, diphtheria vaccine is included in EPI schedule. It is given on 6 weeks, 10 weeks, and 14 weeks with pentavalent vaccine. Then booster dose is given at the age of 2 years and 5 years. This is specific protection of diphtheria. Its vaccine can be given at any age. You have to isolate, you have to notify, you have to disinfect, you have to create awareness, you have to improve hygiene and diet. Things to remember: vaccination at any age and the EPI schedule of diphtheria, antitoxins, antibiotics. Then we discuss pertussis or whooping cough. Whooping cough, it's a cough. It is also called 100-day cough. It produces whoop, croak. Child is malnourished. Child is having cough. It's a bacterial infection. It is caused by Bordetella pertussis and Bordetella parapertussis. Major symptom is cough. Child becomes cyanose during the cough. Child has vomiting during the cough. Cough is episodic. Cough is non-productive. Then mild to moderate fever is other sign of pertussis. We'll diagnose it clinically. Then we'll treat it. It's a bacterial infection, so we can give antibiotics. Erythromycin, penicillin. Always remember, if child is having cough and cyanosis, you have to give oxygen. So we can give O2 inhalation. We can give antitussives, antipyretics, antibiotics. And we have to maintain hydration in pertussis. Cause during vomiting or during high cough, child becomes dehydrated. This is management. How to prevent it? Like diphtheria, its vaccine is included in EPI. Both are given at the same age, at 6 weeks, 10 weeks, 14 weeks. Booster dose is given at the age of 2 years and 5 years. You have to remember complications of pertussis. Cough can cause rib fracture, can cause hernia, can cause rectal prolapse, can cause pneumothorax. Other complications are same as other diseases like pneumonia, encephalitis. So, pertussis is common in children less than 1 year, in low socioeconomic status children, those who are malnourished. Child may look weak, pale, dehydrated. There will be history of cough. So you can distinguish between pertussis and diphtheria. Remember, specific protection is same. So you can remember by vaccination schedule, by isolation notification. Positive agents are different. Age is different. One is common in children, other is common in maybe common in older age. Those who are working in PEDS ward, they can have diphtheria. And in diphtheria, you must remember Schick test. It's a common university question. So this is all for diphtheria and pertussis.